Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractic clinic. This video has to do with dizziness. Why in the heck you're dizzy? Stay tuned. All right, let's talk about dizziness. Is dizziness all middle ear issues? Is this like a new epidemic? Because I used to hear, I've been in practice over 2 decades. So I used to hear older people talk about dizziness and how, they felt dizzy. I used to hear dizziness with ear infection. Now it seems like everyone and their family are having dizziness. So what's that all about? One thing that hardly ever gets explored, and yet I bet you anything, most chiropractic offices are seeing patients with dizziness as their complaint, has to do with your cervical or your neck flexors. As you're sitting behind a computer, typing away, as you're looking down at your computer, Instagram, YouTubing away, as you're looking at your laptop and doing the same thing, your neck flexors here are overworking. When they overwork, they flex the neck down. So you're not going to be looking downward. You're going to have to do something to do that, which is exactly what I'm doing, which is going to require the back of the neck muscles to overly stretch. Bottom line is the balance between the flexors and the extensors is gone. Now you add the factor of looking this way to scroll, or looking at your monitor slightly off to the side. Instead of looking here, you're looking there as you're typing. Now there is this subtle, more tension on one side than the other. So now go ahead and grab this big muscle here on your neck. Go as close to your ear as you can and start pulling it down. Right? Here's the ear, the back of the ear bone, and you're going to grab that SCM and start pulling it down. You'll notice that the pressure, you're pulling your ear canal down. Now, put this fact aside. Inside your ears, as you look through the ear, you go through this canal at the end of which is your eardrum. Behind the eardrum, there are 3 bones on each side. Their job, which is function of your hearing nerve, has nothing to do with hearing, has everything to do with balancing. One of those ears gives this positioning information to your brain. Another one does this. And finally, the last one gives the diagonal information to your brain to balance. As this side muscle is pulling down on the canal, it compromises the positioning of those bones and therefore creates dizziness. Not every dizziness is an ear infection. In fact, hardly any these days are. You gotta understand your posture plays a huge role in your well-being. It's not aesthetic, it's not it looks better, has everything to do with your health. So next time you're dizzy, next time you hear someone being dizzy, think about the posture and how to balance it. Make sure you subscribe to my YouTube channel. Ask any questions you may have down here, or use one of the methods of contact to contact me, and make sure you look into this. This is just the tip of the iceberg. If you don't look into it, I promise you'll have plenty to worry about later on, which is not what I'm hoping for. Thanks for watching and take care.